Hello, friends. Welcome back to the School Transportation Nation podcast. This week, I'm Tony Corbin, the publisher of STN. I want to thank you for joining us for episode 18, brought to you by Transfinder, the leader in school bus routing software. Stay tuned for our tech tip from Zonar as well.
And I'm Ryan Gray, editor-in-chief at School Transportation News. We have an action-packed episode this week. We always do, right? But especially this week, 3 guests on the docket. We'll hear 2 different transportation perspectives on school restart, one from north of the border in Canada and one from Florida. A little bit later, we'll be joined by Dr. Alice Kuo. She is Chief of Medicine and Pediatrics at the University of California, Los Angeles, and past president of the Southern California chapter of the American Academy of Pediatrics. So sharing some medical perspective for us.
That's a great lineup, Ryan. Looking forward to it. All right. What is going on out there in the news? So much, so many headlines. It's moving so fast. Shifts, new headlines. What's going on? Tell us, Ryan.
Obviously, getting more information out there about school districts going back to school and what those plans look like. More and more school districts are saying that they're going to start the school year at least with an online learning model and then might transition to a hybrid model before eventually hopefully going back to in-person classes. So a lot of what's driving the national conversation right now is kind of the politicization of the whole COVID-19 dealio going on. A lot of attention right now, of course, on the Trump administration. A lot of people thinking that they're downplaying or have been downplaying the COVID-19 situation. Some are just flat out accusing the Trump administration of bearing the latest recommendations coming from the Centers for Disease Control and Prevention, the CDC, right? So there's been a lot of news about Dr. Fauci, who's at the National Infectious Disease Center, kind of being pushed out, and then at CDC, not allowing CDC to be a part of White House briefings or press conferences. Back to this report that was supposed to come out in July, earlier in July, and it was some of the details were leaked a little bit. CDC said the lowest risk is students and teachers engaging in virtual only classes, activities, and events. So no school bus rides, no athletic team sports schedules, no field trips, nada. What we saw, and this has come out in the press, is that the Trump administration really pushed back on CDC to revise some of those requirements, which they evidently are in the midst of doing. So we might be actually this week seeing the fruits of that labor come to fruition. So wait and see on that. But again, does this suggest that school bus routes by grade and age group and keeping them together throughout the day or cohort transportation is perhaps a model? And what we need to remember too is it really depends on the area of the country or the area of North America where school districts are. Certainly school districts that are located in hotbed areas like California, New York, Washington State, Florida, Texas, they need to really be careful in how they reopen. Certainly in urban areas, that's where we see a big spike. There's a new tool that I saw last week coming out of Georgia Tech University where it provides an interactive map where you can select counties across the state and it will tell you the probability of contracting COVID-19 based upon the number of folks that gather for an event or in a certain area. So, obviously there's a lot to still continue chewing on. But last week, President Trump did admit that COVID-19 will likely get much worse before it gets better. Certainly such a statement doesn't bode well for the schools, for our economy. We have seen the economy rebound somewhat over the last couple of months. Job numbers are looking a lot better. A lot of that is tied to the reopening of states, and we're seeing restaurants reopen, but then big spike, and we're starting to see them close down again. So we'll have to see how school districts are able to respond to this. For example, Seattle Public Schools announced last week that it will now decide by the middle of August in a board meeting if it goes to a full remote online learning model after just a couple weeks ago saying it expected to enter into a hybrid model of in-class and remote learning. Caught up with our good friend, Dr. Steven Sroka, who many of you know from his appearances at STN Expo Reno. He was on a podcast in March with us. He relayed that there's 3 things that he's learned about COVID so far. Number 1, things change fast, so stay tuned. Number 2, never say never. And number 3, there are no easy solutions or guarantees, only intelligent alternatives. based upon science and data-driven facts, not opinions or fears that reduce but do not eliminate the risks. Speaking of which, we'll be joined in a little bit by Dr. Alice Kuo from UCLA. I mentioned earlier she's the chief of pediatrics there for the medical school, as well as the past president of the Southern California chapter of the American Association of Pediatrics. So she's going to shed some more light on kind of what's going on in the medical world. Again, there's just a lot of fear that's continuing to resonate about the ability of children to maybe withstand COVID, maybe not. The New York Times reported that there was a South Korean study that found that children between 10 and 19 years old spread the novel coronavirus as well and as often as adults do. So that kind of flies in the face of some other things we've heard. She'll help us get to the bottom of some of that.
Yeah, great information, Ryan. I know I've received email correspondence from my school, from my kindergartner to go into first grade. And I'm reading between the lines and they're basically saying, hey, school might not start up. You're likely going to be going to that distance learning model. At the earliest, school is going to start in October, maybe. And then also it's possible 2021. So I think that's a reality parents are having to come to grips with. I'll tell you, when you get that news as a parent, you say to yourself, hey, what are we going to do? How are we going to go back into this homeschool virtual learning model for our kids? What does that mean for us as parents going to work? All those kind of nuances. So millions and millions of families are going to be facing this. Now, it may be different everywhere, right? National problems, local solution there, depending on the situation. It all appears to be different. Who knows how it's all going to shake out? As Dr. Soroka says, never say never, and things change fast. Stay tuned. So I'm a strong believer in those things. Ryan, I know recently we had a webinar on preparing student transporters to once again start busing students. Lots of valuable information that was gleaned from that. You want to give us a little cliff notes? What happened?
Yeah, sure. So that was last week. If you want to revisit that or watch that webinar, please go to stnonline.com/tag/webinars, and you can access that for free. If you're already signed up, great. Just sign in or create an account. That's free and 24/7. So we had 3 child passenger safety technicians jump on with us. Denise Donaldson, who is the editor and publisher of Safe Ride News, as well as a member of the Child Passenger Safety Board. Sue Schutrump, of course, one of our illustrious tenured faculty members for the TSD conference, and Charlie Vitz, who is the market development manager for IMMI Safeguard. They were discussing the planning that's necessary to transport students specifically with disabilities and preschoolers, those who require the child safety restraints and car seats that so many of our audience use. And of course, they rely on training that we provide at our STN Expo conferences. That training, that hands-on 8-hour child passenger safety course seminar sponsored by the National Highway Traffic Safety Administration. Obviously, we were supposed to offer that in Reno in mid-July. That didn't happen. We've had to push that conference out till November, hopefully. Still planning to do the NHTSA training in Indianapolis. And I should say, even if we can do Reno, we're likely not going to do the NHTSA. So we were thinking, how can we get some information out to folks as they're trying to get back to school? They're trying to get their folks trained. We know we can't do in-person hands-on training, especially online. So what can we do? So they came on and they talked about a lot of the considerations that school districts need to be making to safely transport these kids, because these at-risk kids, we know that if anyone's going to go back to in-class school, it's likely going to be these kids or some semblance of that. Because as what we've seen over and over again, and we've talked about this, the online distance learning does not work well, especially for students with disabilities. So it's going to be really imperative that those kids get as much in-person instruction as possible. So how do we get them on the bus? Obviously, physical distancing is hard enough on a school bus with quote-unquote general education kids, but unrealistic, if not at least problematic, for students that have trach tubes, that are in wheelchairs, that require all these different 5-point safety vests and whatnot, car seats. How do you continue to provide the necessary up-close and personal service for these kids? You have a lot of monitors on these kids. These kids can't wear masks because they're not able to physically remove them, or they, like I mentioned, they could have respiratory problems. They could be nonverbal, and drivers and monitors need to be able to see these students to get those cues. And if you have a mask, you're not going to get that. Our team got on here, gave a lot of great information on some techniques, some tips to address those. They talked about the STARTS task force. It has 17 individual guidelines and task lists for just transporting students with disabilities. Our team talked about that, talked about cleaning these equipment without compromising their crash worthiness, talked about the collaboration needed with IEP teams and parents to determine the risk of students, especially those with the most common or problematic medical conditions. A lot of really great information. Really encourage everyone to head over to our multimedia section on stnonline.com. Go ahead, access that webinar. It was about 90 minutes or so, and we actually ran a little bit long, but we will continue on this path, getting you more information. Stay tuned.
Thanks, Ryan. Yeah, you guys took a really deep dive on everything people are doing, and they covered a lot of ground about how districts can address the COVID situation and prepare. And, it's all about preparing right now, and you've got to have technology at your fingertips to be prepared. But how are you going to pay for it, right? Budgets are stretched, and that answer can be found in today's tech tip that's brought to you by Zonar, a leader in smart fleet management. Technology initiatives are not cheap. The CARES Act can help, but those funds are running out quickly. Now's the time to look at federal, state, and local grants to fill the gaps. Learn more about Zonar Grant Assistance Program and their partner, Learn, Design, Apply, who can help identify, apply for, and manage new opportunities, including COVID-specific funds. Learn more at zonarsystems.com/grants. That's zonarsystems.com/grants. Next, we're going to hear from the first of our three guests today, Arby Creech of Osceola District Schools in Florida.
Everyone, we know you're all busy with developing back to school plans, and in our continuous effort to provide visibility on what districts are doing nationwide, want to welcome to the stage Arby Creech, Director of Transportation Services for Osceola District Schools in Florida. Arby, how you doing?
Hey, Ryan, thanks for having me on today. We're doing great out here in Florida.
Great. Well, as I was joking with you earlier, Florida likes to be in the news, don't you?
Absolutely. It's never a dull place to live or work. It's just changing every day. And we absolutely love that spotlight. We're always up for that challenge.
So that spotlight was shown recently by Education Commissioner Robert Corcoran, who issued an executive order that on its face, it looked like that it was demanding or requiring all schools to go back to physical in-class learning. Not quite the case, but I know that there are some lawsuits pending right now coming out of Miami and some other places. Can you make some sense of what some of the challenges that you all are facing down there in Florida?
Yeah, absolutely. So we had anticipated that the commissioner would come out and kind of give a directive that all of the schools reopen and provide services 5 days a week, give parents and students a choice. And that's basically what our district has focused on. The big thing at this point is that now there is a group, the Florida Professional Educators Association, which is a very large union out of Orange County. And they're suing the governor now, saying that he's overstepping his bounds and that it's not quite a safe place to work and that he has to prove that before they would go back to school. However, that's our neighboring district. That's Orange County. And of course, Osceola is a bedroom county to Orange. But we've been going, full speed ahead. And our board got together, of course, with our superintendent and went out and did some parent surveys to find out what they were thinking and basically gave them a choice and said, you can do face-to-face, you can do digital, you can do a blend of face-to-face and digital, and or you can enroll in Florida's virtual school. So it was amazing that the majority of the people were really ready for their students to go back face-to-face. And then about roughly half of the remaining parents wanted a blend. Obviously, the minor part of the survey, they wanted to enroll in the Florida virtual schools. But what that told us was that basically they were interested in buses and that we needed to get ready and be up for the challenge. So we've been spending a lot of time getting our buses ready, getting our protocols ready, training our drivers and getting everything ready to rock and roll so that when we open, we're going to be up to the challenge because it all starts with us. We're the first school-based entity that they see first thing in the morning. So if we're not safe on that school bus, that won't transition into the classroom. And we've got to instill that in the parents. So that's what we've been working towards.
Okay. And I know that the set plan has not been published yet by your school district on exactly which route you're going. But like you said, you have to have transportation at the ready. So as of right now, late July, what is your plans for restarting the school buses? Are you looking at physical distancing on the bus, multiple tiers, cohort transportation? What's it looking like?
Well, fortunately for us, we're a medium-sized district, so we're not bound by those logistical issues that larger districts might be bound by. So it gives us actually more choices. At this point, what we've done is we've spent a lot of time training our drivers. We've looked at protocols for disinfecting the buses, and our superintendent has asked us to load the buses at 2 students per seat with masks on, and to basically sequence our loading so that we minimize the amount of traffic up and down the aisleways of the buses. We feel like that's probably one of the best things that we can do. We've also added hand sanitizers to the buses, and we do deep cleanings in between the runs. And we're going to do that extra effort that it takes to make sure these kids feel safe and that they comply with what we're going to do. We have not had to add at this point additional buses, and we're not doing any creative scheduling because we're really not sure at this point who's going to show up at that bus stop. During some of those surveys I talked about, we did notice that a lot of the parents wanted to perhaps start digital learning and then maybe transition to face-to-face as they felt more comfortable. So we, basically we're prepared to handle that load as well. But at this point, I think that we're ready to go and we're up for the challenge.
Okay. And what about screening students before they get on the bus? Some districts are saying, hey, we're going to wait until the kids get to school, because if we're trying to do that at the bus stop, that could make the routes longer. And as you mentioned, you don't have some of the constraints that larger, more urban school districts, or perhaps like someone like Orange County Public Schools just near you there in Orlando might have. But what's your plan right now looking like in trying to determine health screening?
So absolutely. And there was a lot of talk about what we would do when we approach the stops. And there's been a lot of messages gone out to parents that said, hey, parents, please go out and be with your students at the bus stops, help them social distance, and help them understand the gravity of the situation and the necessity for the mask and the necessity for basically minimizing contact. There was talk about taking temperatures at bus stops. But one of our golden rules is that we never leave a student standing at a stop. So one of the questions came up, and the question was, so I take the temperature of one of the students as they step on board the bus and it's 100.4 or higher. What do we do? And, we went through every possible scenario. And one of the things we said was, number one, we've got to take them to school. So why even bother with the temperature issue? Let them take the temperatures at school and they can deal with it there. But unfortunately, once we found out that perhaps one of those students did have a temperature, now what do we do with the bus? We've got to go back, deep clean it, the sanitization protocols that we have to go through. And we have to make sure that the driver and perhaps the bus attendant are aware that there was incidental contact and determine whether or not that driver and that bus attendant might need to be tested. And of course, everyone else on the bus that might have sat next to that child or had contact with that child. So that's going to be something that we're going to have to deal with as we get to that point, because it's really unclear as to how we're going to overall handle that situation. But we have enough protocols in place, I think, that everybody's going to feel comfortable with it.
And you touched on this, with contact tracing. That's come up into the lexicon of school transportation. Some departments are telling me that they're utilizing or able to utilize existing student tracking technology. You were mentioning knowing, what kids are on the bus and what days and the driver. Have you given any thought on how you would deal with situations should a student or a driver or monitor become ill?
Oh, absolutely. And because we use an outstanding piece of software for our routing system, we can go back and we know exactly who's going to be on that bus because of basically the loads and the way we set them up. We do have the electronic capability of having the students bring ID cards, but that hasn't been talked about at this point. It's just one of those technologies that's been on the buses, but we really haven't utilized it because of some logistical issues. But the software will help us trace that, and we can go back and make the contacts. We also use a really neat piece of software called Bus Bulletin, and what it does is it allows us to push messages out to parents in pre-canned messages or customized messages so that we could do that contact tracing if necessary and push it out to the parents and say, hey, this is what happened and this is what we suggest you do. So that's a nice piece of software that many districts don't have, and we're very fortunate. We're anxious to use it if we need to.
And you mentioned deep cleaning of the bus, right?
Right.
Interested what some of those procedures are, because there have been a lot of concerns, and I wrote an article in our July issue that touched on this, with introducing some unintended consequences, perhaps, of using household disinfectants with chemicals that could actually degrade things like belt buckles. I know that Florida has a law for lap belts, but whether it be 3-pointer lap or even the bus seat vinyl, those kind of things. What are some of your concerns that you're looking at as you move forward with trying to make sure the bus is a sanitary environment?
What's very interesting about that is that we have, over the years, used a product that is not harmful to our seats or plastics. Additionally, it doesn't typically invade the nooks and crannies of the electronics. And it's, believe it or not, it's a very powerful hospital-grade disinfectant. So we're going to continue to use that, but we're also going to balance that with something called BioShield, which leaves a 90-day residual. So we'll go in, as a matter of fact, we've already gone in, and every bus has been completely sanitized and deep cleaned. But after every morning run, the drivers will go back down, wipe down all the seat surfaces, wipe down all the plastics, and wipe down all the, the areas that may be commonly touched. And then when they get back to the bus compound, we go in with a backpack sprayer, which is an atomizer with the BioShield, and we fog the entire interior of the bus. It's left wet, and then it evaporates at that point, and it leaves that residual. Now, what's interesting, and we probably have an advantage over some of the northern states, is that in Florida, like Texas and in the southern Southwest, the buses sit in the sun all day. Those buses will get, 120, 125, sometimes 130 degrees. And the interesting thing from the CDC is that the COVID virus starts to die at around 130 degrees. So in some senses of the word, if you think about it, our buses are a little bit self-sanitizing if they sit in the sun long enough. So we're banking on the heat inside that bus to also help us out. But I think with the BioShield and the something called ZD3, which is a hospital-grade disinfectant that we use, the atomizers and all the cleaning efforts, I think we're going to be fine.
Oh, sunshine. You can't beat it.
Can't beat it.
Also want to touch on, you were mentioning staff training. You've been doing a lot of that. Obviously, school closures all over the nation. Many drivers have been at home this whole time if there wasn't any food delivery, homework delivery, internet access, those kind of things. So bus drivers, when they do come back to work, it might be 5 months before they've stepped foot on the bus. What has been your experience in trying to keep training alive? Have you had to go to virtual? Have you been able to do it in person still?
Well, we've taken two approaches to that. One is that while our drivers were at home, we went out to a private vendor company and asked them to help us out with some online training and get some professional development done. We had about a 98% response on our drivers, which was incredible. They went out and they found the information to be very valid, very current, and they all completed all the professional development, something like 38 hours that we asked them to do. And they did that over the period of time. We also called them every day and checked in with them to make sure they were safe and that they were healthy, just kept an eye on what their status was. Of course, at the same time, remember, they're also getting paid. We normally would do summer school in the month of June for the extended school year, which is federally required. But this year it was all digital. And then after Commissioner Cochran came out and said that we would go back to school and the CARES Act provided some funding for some summer school, we actually launched 12 days of summer school in the month of July, which was a lot different for us because that's normally the time that we're building routes to open the school year in August. So we're actually winding up today with the last of our summer school. And that gave a lot of the drivers a chance to come back and be proficient in the seat, sharpen their skills that might have gotten them just a little bit lax. But we are concerned that you sit away from the bus and you're not behind that wheel, and perhaps your skills need a little bit of sharpening. So we've added additional days for driver training before we open on the 21st. And that will give our drivers an additional chance to go out and just refamiliarize themselves with the driver area in the bus and remember where the switches were and what their procedures are. Additionally, our managers and our trainers will be on board with them as well, just to make sure they're not having any problems. So we think that we fairly well will cover that area and that our drivers will be just as safe as they possibly can when we open school on August 21st.
Okay, great. And last but not least, let's talk money. Budgets. What has this whole COVID-19 thing done to your transportation budget, both in the here and now, as well as putting your prognostication hat on? What's it looking like for the future? How is this affecting student transportation?
Ryan, that's a very, very interesting question because in the state of Florida, a large portion of our revenue is generated by tourists and the tourism taxes and all the things that go on in the areas of, hotels, motels, the beaches, obviously Disney World and SeaWorld and those kinds of things. So a lot of that money is generated by people coming to visit. They obviously haven't been coming to visit. I'm keeping a close ear to the ground in terms of what's happening with the budget at the state level. Right now, my budget has not been touched, and I'm very surprised. We were given our budget allocations about 3 or 4 weeks ago, and I fully expected there might be some cuts, but there have not been to this point. Now, all that being said, of course, we have an election coming up in November, and, sometimes you have to think ahead and say, well, after the election, who knows what might happen? And or if the economy doesn't come back as strongly as they're predicting, and fortunately, some of the indicators are that it's on its way up. But if that doesn't happen in Florida, then yes, I can see that down the road, we might end up having to go back in and squeeze out a few dollars less and do the same job that we have now a little bit more efficiently with a few less dollars. In any case, we're going to be prepared to do that. But, all bets are off at this point. We just have to kind of hold our breath and watch what's going to happen out there. So for us, it's really about what people do and how people feel about coming to Florida, going to the theme parks and enjoying their vacations, because that's our lifeblood. And we really do depend on that.
So how important is collaboration and partnerships and all that when, obviously school transportation dollars have always been, or traditionally, historically, we've had some shortfalls, at least comparatively to the rest of the school district, especially in classroom, always battling for funds, right? How important is it to really engage your partners at the table when trying to figure out all that mess?
Well, absolutely. That's of the utmost importance. We have to justify everything we do in the economy scale that we operate on. And they also understand that we transport about half of the students that come to the classroom every day. We are a very rural district. We're about 1,300 square miles. Some of our bus rides are an hour and 20 minutes. They will be 57 to 60 miles one way sometimes. So, transportation is of the utmost importance, especially in where we live in terms of getting those students to the brick and mortar classrooms. So collaboration is absolutely important, that we sit at that table, that we talk about our needs, that we talk about the efficiencies and the way that we can do more with less. We continue to do that every day. Along that route, too, we participate in our Florida Association for Pupil Transportation. We have our webinars and our Zoom meetings, and we constantly compare notes across the 67 districts in the state, and we try to find the best practices and the best efficiencies that we can. So our association is very strong, and our collaboration with not only our peers, but also with the teachers and the upper leadership that we deal with every day, they understand. And so far, we've been okay. So far, we've gotten everything that we needed, and we feel very good about that.
It would be remiss of me also not to point out that, Arby, you're a past president of the Florida Association for Pupil Transportation. So I wanted to just get that plug in there. And thank you so much for sharing what's going on there in Osceola County with our audience. Keep fighting the good fight.
We thank you, Ryan, and Tony, and Claudia. Thanks for being in the background back there and taking care of all the technical part. And we really appreciate the opportunity to share. We wish you well, and you guys stay safe out there, and our best to your families.
Likewise. Thank you, Arby.
Take care.
Hey, thanks for that, Ryan and Arby. Great conversation. You're correct. Partnerships are very valuable this day and age. And our friends at Transfinder, the sponsor of this episode, understands that too. And to tell the story of a successful partnership, I have Christy Edwards, the Transportation Secretary at Livingston Range School District in Southern Alberta, Canada. Christy, welcome to the podcast.
Hi, thanks for having me.
Absolutely. So, Christy, can you give us an update on what is going on up in Alberta? Are you guys starting school up there? What's the latest and greatest?
Yeah, we just got notified on July 21st from our provincial government that we will be heading back to classes. In September, we're going to be going back to school, and there will be some health precautions put in place, but we will be transporting students and getting them to school, and hopefully we're going to get back to some semblance of normal.
Wow, that's great. Yeah, down here in the States, it's a little bit of a different story right now, but that's exciting. How are you guys getting up to speed for reopening?
We have had the last, obviously, 5 months to prepare, and we've been working on it ever since then. So we've got all sorts of policies and procedures in place for sanitizing and disinfecting our buses and making sure that they're ready to go for the students. We have policies and procedures for our drivers on loading and unloading, all sorts of things that we've been working towards to help get everybody ready. We've been making sure that all of our routing is up to date and that we are at the right amount of students per route so that we're not overcrowding our buses, so that there's lots of distance between students. All those things have been on the list of what we've been working towards for the last few months. And now we're just going to put it into practice and start ordering all sorts of supplies. So hopefully we'll be ready when September rolls around.
Wonderful. I understand you're using the new Transfinder product, the Route Finder Plus. Can you share a little bit about how that's assisting you with reopening?
Absolutely. So we just are finishing doing our kind of startup training for Route Finder Plus. And I do have to say that I'm a bit blown away by the abilities of this program. It's such an upgrade from Route Finder Pro. I can't even explain it because it's pretty phenomenal. Just mapping, like even just the basic map is so much clearer. It's so much easier to locate and find my students. The data that I'm able to send to Transfinder to upload is specific to our area. So I was able to get data from the different counties in our area. And now I can upload exactly every address in the county and it's all on the map. It's way more user friendly. So it's helping with my speed and the ability to be more efficient, which is great. As well as when it comes to assigning routes, it's so much easier to get the kids on which bus they need to be on and moving them between routes. It takes seconds instead of headaches and having to just move in and out of windows. You can do it all in the same spot. It's really such a great program, and I'm super excited to keep working in it and to get more and more efficient with it because I'm already blown away. So I can only imagine after I've had some time to use it that it's going to just become more and more critical to making our transportation department run efficiently.
How did you get up to speed on how to use the software more efficiently? What was the process in that?
So normally we would have gone to some conference or something and had this, but because of the COVID situation, we did 2 8-hour days of training and they called it Transfinder University. And at first I was super skeptical of the whole 2 8-hour days of online Zoom classes, thinking that wasn't going to be very effective in teaching us how to use the program. But I was really pleasantly surprised with how great it was. Caitlin and Kristen were amazing. They were great teachers. They kept us all engaged and focused. It was really great actually to meet and make contact with other people who were also making the jump to Plus. And we were able to make some connections there and kind of feed off of each other's ideas. And it was really worth the time. It was a long 2 days, but by the end of that, I felt like we had made the right choice to upgrade our software into the Route Finder Plus.
That's excellent. Well, I'm not sure if you knew, but STN is launching the first ever virtual bus technology summit, September 22nd through the 24th. We'll have a virtual conference, trade show sessions, networking components, a huge new product reveal. We're even doing the first ever Bus Technology Summit Innovation Awards. So it's going to be amazing. So I'm glad you had a really positive experience with virtual training. So love to invite you and your team to participate. It's free of charge to attendees, so definitely check that out. It's bustechsummit.com for more details. I want to thank you for coming on the podcast. Stay tuned, friends. You won't want to miss our next guest, Dr. Alice Kuo, the head of pediatric medicine at UCLA.
We're pleased to have with us now Dr. Alice Kuo. She is the Director of Maternal and Child Health at UCLA and Chief of Medicine Pediatrics at the university. She is also the President of the Southern California chapter of the American Academy of Pediatrics. Thank you so much for being with us today, Dr. Kuo.
Thank you for having me. And just to clarify, I'm past president, but that's okay.
Oh, but there you go. Speaking of which, the Orange County Board of Education cited you specifically when it came out with its guidance recently on getting back to school, where as opposed to LA Unified and some of the neighboring school districts, they're really advocating to go back to all in-class education. Certainly, when your statement came out in June, when your organization was really advocating for that same thing because of total child health, that it was better for them to get in class, a lot has changed over that past month or so. Can you explain some of the discrepancies that we're seeing out there between different studies that are now coming out saying that children actually are at risk of COVID-19?
Sure. So when we released our press statement, it was, I think, June 2nd. It was in a very different time when you look at the impact of the pandemic here in the state of California, or even more locally in Southern California. So at that time, numbers were lower, and we hadn't, I think we were probably just before the increase that we're seeing now in the middle of July. And so, the studies are still pretty much the same. We do recognize that COVID-19 is transmitted at a much lower rate in children than adults. I think that is widely accepted in most academic circles. I know the issue has become extremely politicized, especially at the national level, but the studies are still the same. I think when it comes to statistics and trying to interpret scientific studies and epidemiologic studies, people can often take one finding and make that the headline. And I think it's very important now to look at these studies in the context of what's going on in the pandemic. More and more research is coming out, and I think that while we understand that transmission is much lower in children, I think what people want to know in the United States is, what is that going to mean when schools reopen? I think what we want to emphasize is, from the American Academy of Pediatrics, is that if schools do reopen, they should do so safely. We have said that all along. We have not said at any time that they should just open regardless of the external circumstances. But I do think that we recognize also how important schools are in the lives of children and families. And so we are encouraging prioritization of opening of schools, maybe before things like restaurants and bars, even, simply because, that's such an important segment of our society. And I think as AAP, we advocate for children and children's health because they often don't have people advocating for them.
And also, too, you were talking about in your statement the need for school district guidelines to remain flexible, right, for different age groups of students especially. And you've read a lot of articles out there, studies, if you will, about the use of masks. What should our readers and audience know when they're trying to determine policies in their own school districts for getting kids back on the bus? What kids should be wearing masks and which ones it might be inappropriate for?
Right. So here what we see, I'll address both issues, the flexibility and the mask question. So I think, again, this is very local, and I am situated in Los Angeles, so I can speak to what's going on here. Interestingly, as things have evolved over the past 6 weeks, I'm very heartened to say that it seems as though our state and our county are working together for that flexibility. So on last Friday, Governor Newsom made a statement at noon talking about schools in the counties that are on the state's monitoring list could not return to in-person education at all. And this applied to both public and private schools. However, there is a waiver mechanism. So if you are in those counties and your local conditions are better than the rest of your counties, and your county health officer agrees, the health officer is able to grant a waiver for transitional kindergarten through 6th grade. And this is that kind of flexibility that the AAP was referring to, because that is actually in line with what the science supports, which is that secondary is a little more concerning, children 12 and older, for transmission, because they do seem to be greater than those younger than 12. And even when you get into the older age groups like 16, 17, 18, may be almost similar to adults. And so this approach of flexibility, allowing counties who maybe shouldn't consider opening, but maybe large like Los Angeles County. So we have communities in which the numbers are raging, and other parts of LA County in which the numbers are better, that some schools in those areas could consider reopening for in-person education, provided that they fulfill all the criteria. Detailed protocols the LA County Department of Public Health has issued to new protocol forms that need to be filled out. And so, with the appropriate safety measures in place, that these schools could consider reopening. On the issue of masks, again, you see that difference between what the state has said and what our county has said. So the state provision, the governor recommendations are for third grade and above should be wearing masks. And so recognizing the developmental needs of younger children, the ability to read facial expressions when they're trying to learn language and trying to establish their emotional regulation patterns for social emotional development. But because of the numbers in Los Angeles County, our county health officer has said, or our public health director has said, masks for 2 and above. So there's that discrepancy, because I think it's desirable for all people to wear masks. I think the evidence is clear that masks are a very effective mitigation measure to prevent the transmission of COVID or SARS-CoV-2. But parents struggle to have younger children wear masks. And you can have 2 and 3-year-olds who are maybe a little more docile and will tolerate wearing a mask. And you have 5 and 6-year-olds who their families might really struggle if there's some sensory issues or just behavioral issues going on. So Dr. Ferrer in LA County has said that on the masking issue, her expectation or her intention is that the exceptions are very rare. And so the population for whom wearing a mask might be exempted would be deaf and hard of hearing students who rely on lip reading of those around them, younger children for whom there is a medical or behavioral concern that does just make it very, very difficult. And so I think the message is that masks are important. And it's not that anybody should disregard that and not wear a mask, but there are situations that have to be considered on an individual basis if that is not able to happen.
Certainly for, like you mentioned, students with disabilities, obviously our audience transports a lot of these children nationwide who might have breathing tubes or some kind of condition where you need, like you mentioned, the need for them to be able to communicate so you can see if they're having trouble breathing or something. And obviously a mask would inhibit that.
Correct.
I want to transition real quickly and we'll end here. There was some promising news this past week on vaccines. Evidently, there's some 150 in development and a lot of trials are being fast-tracked where they're going straight to market with them or hoping to. How realistic do you think it is that we're going to have a vaccine by the end of this year, if not, hopefully before the end of the 2021 school year?
Right. So, this is a tricky question. I think all of us hope that there will be no hiccups and this vaccine production will go straight through. And I join that. I hope that this pandemic will look a lot different in a year. I think it's pretty promising. Obviously, a big part of vaccine development is having enough resources. So the fact that the federal government has poured, billions of dollars into this definitely makes it more likely that we can get from the research and development phase into actually vaccinating populations of people. So I think it's promising. I guess for me personally, as I'm more of a realist. I am aware that vaccine development takes a while and there's many stages, and we're about halfway through where I think phase 3 of clinical trials, and there's still regulatory and quality hoops that need to be jumped through, and then the whole production part. But I'm hopeful. I think if it does happen, it will be probably the fastest a vaccine has ever been developed. But just realistically, vaccine development is pretty challenging and difficult. And, most vaccines take more than a year to make. But we have definitely progressed much faster than I've ever seen in the past. So I guess you could say cautiously optimistic.
That's a good word. That's what we've been saying a lot of lately. And of course, part of those challenges too is we've seen vaccine rates decline for decades now as, parents are seemingly having less confidence in the science or in the vaccines or because of the politically charged environment that you mentioned before. So really, hopefully once we do have a vaccine sooner rather than later, but then it's really about the parents getting their kids vaccinated, right?
100%. And so, vaccine and anti-vax sentiments and challenges with vaccination rates have been long standing in the purview of the AAP for decades. And, we're very vocal and active in passing SB 277 in 2015 and then SB 276 last year to really try to improve our vaccination rates here in California. I think you're right. There are many families and parents who believe that, natural is the way to go and they don't want their children vaccinated. It will be very curious. For years as a pediatrician, I've said to vaccine hesitant parents, you guys have never seen, we have not lived through pandemics or epidemics even in which a vaccine would have helped. And that's why people who lived through polio and lived through measles and all of that are such staunch vaccine supporters. One would hope that now, having lived through a pandemic and seeing what havoc it can wreak on our economy and our society, that more parents would be inclined to go ahead and vaccinate. I will be very curious to see whether that happens when the vaccine is available.
We will be very curious as well. Dr. Alice Kuo, thank you so much for joining us today. We really appreciate it.
Thank you for having me.
Thanks to Arby, Christy, and Dr. Kuo for coming on the podcast. We appreciate all your insights and the valuable information you provided today. Friends, remember you can visit our website, stnonline.com, for all the latest news and perspectives on coronavirus and school startup. Thanks again to our sponsors, Transfinder and Zonar. Stay safe and be well. See you next time.